Hello everyone, and welcome to this audio podcast. As part of the Myelin episode. This audio podcast is part of the Screech and Hurdle. This audio podcast is part of the Lab Squad Gorilla. This audio podcast as part of a Storm Robotics production. Through this audio podcast, a look at an overview in around some works by science student by pharmacology student C. Jefferson, who developed some really informative works. Informative works looking at neurotransmitters in navigating the neuronal highway or neuronal highway or neuronal pathway. So in this audio podcast, as part of this audio podcast episode, there will be some references and citations which listeners and viewers can check out to identify some additional works in around the theme of this works. So the nervous system is organized into two divisions: the central nervous system and the peripheral nervous system. The central nervous system is made up of the brain and the spinal cord, where the peripheral nervous system is all other where the peripheral nervous system is all other nervous tissue in the body. Both divisions contain, both the central nervous system and the peripheral nervous system contain neurons and glial cells. Neurons are normally long-lived cells with an excitable membrane allowing the generation of action potentials. They cannot be divided by mitosis, and the lack of centrioles. So therefore cannot be replaced or can't be replaced in the case of in the case of where illnesses and sort of disease are concerned. Neurons are made up of the cell body, axon, and dendrites, which are important in the intracellular communication and as part of intracellular communication. Axons can be made can be up to anything from up to 1 meter in length, and are located 1 meter in length, and are the location of action potentials, and commonly have as a coating of what are referred to as Schwann cells, and also where the Schwann cells are also referred to or can be referred to as the myelin sheath, which helps the quicker transmission of action potentials. The six types of glial cells support neurons and their sort of actions. Astrocytes, and satellite cells are utilized for the support of the basis, and oligodendrocytes and Schwann cells are used for insulation in around and when an action potential is generated, the action potential then additionally doesn't sort of call in sort of misnomers, and so the Schwann cells are there, are thus the insulation for as and when for action potentials, and the myelination of neurons, and in around the myelination of neurons, and the function of microglia is sort of the immune immune surveillance and phagocytosis, and ependermal cells sort of create the sort of the CSF, or the cerebral spinal fluid. Neurotransmitters are also sort of compounds that are released by one neuron in order to induce or prevent or preclude an action potential at another neuron. So additionally, looking in around dopamine. So dopamine is primarily a neurotransmitter in the central nervous system that acts under these main sort of under sort of main pathways being referred to as dopaminergic pathways and nigrostriatal, mesolimbic, and in a fundibular, which all play parts in motor control, behavior or attitude of behavior and emotions, and in line to endocrine control accordingly. The development of many neurological disorders or conditions has been linked to an imbalance of dopamine, and so, for example, conditions for example, Parkinson's and schizophrenia, to refer to a few. The patient, in context of this, additionally, there was the pharmacology student C. Jefferson had focused some of their works or some of their works in around a sort of a patient case. So the purpose of this audio podcast, just to inform that context will be anonymized. So a patient anonymous had complaints of bradykinesia, which referred to as slow movement and difficulty with coordination when doing different activities such as parking their vehicle or using stairs, for example. The patient family had also noticed some sort of changes, some other sort of behavioral changes. However, these could simply just be from the frustrations the patient is or had been feeling surrounding some of the concerns. Some investigations carried out by a hospital showed that the patient was not suffering from any tumor, shown by a particular investigation. A particular investigation referred to as a methyl-isobenzyl guanidine test or investigation. The C. Jefferson in their works highlight that they believed that the patient was showing early signs of Parkinson's, which can be or could be identified as the following. There's tremor, rigidity, slowness of movement, and loss of postural balance, leading to sort of other additional symptomologies. Whilst there is or had been no sort of biochemical investigations that were able to diagnose or help diagnose conditions such as Parkinson's. Doctors, physicians, or clinicians had used the patient's medical history and sort of other investigations to make a diagnosis, which was then confirmed. Which was then confirmed if the patient's condition had positive response to pharmacotherapeutics that are in particular in around the use or in around and specific for Parkinson's. For example, Parkinson's is caused by the degeneration of dopaminergic neurons in the substantia nigra region of the basal ganglia. When human beings lose more than 50% of these particular neurons, symptoms such as tremor and bradykinesia are exhibited. There are two types of, or there have been in amongst the sort of pharmacotherapeutics, two types of pharmacotherapeutics that can be used for Parkinson's specifically, and there are these are pharmacotherapies that increase the particularly the dopaminergic activity, and pharmacotherapeutics that reduce the cholinergic effect. One of the most common dopaminergic pharmacotherapeutics is levodopa. Levodopa, or had been levodopa, sort of a pro pharmacotherapeutic that is metabolized into dopamine by dopa decarboxylase in dopaminergic neurons. Once it has crossed the blood-brain barrier, and it had been recommended by within a national formulary that patients experiencing motor symptoms or symptomology should be sort of prescribed levodopa combined with carbidopa. This is because carbidopa has some bases where it irreversibly binds to pyridoxal 5-phosphate, which inhibits or precludes one aromatic amino acid decarboxylase, or AADC, which metabolizes levodopa into dopamine. When taken or when administered on its own, levodopa can cause involuntary movements and postural hypotension, sort of postural hypotension in amongst additional sort of symptomologies aligned to where peripheral metabolism is affected or can be affected. Another pharmacotherapeutic that increases dopaminergic activities is selegiline, which inhibits or precludes monoamine oxidase, inhibits or precludes monoamine oxidase B, or monoamine oxidase B, reducing the metabolism of dopamine, and when combined with levodopa in the early stages of symptomologies around Parkinson's, which can slow the progression, which can also slow down the progression of more of some of and in around the more specific symptomologies in around Parkinson's. So if patients in around this works by C. Jefferson, is where C. Jefferson informs that if the patient's behavioral change if the patient's behavioral changes persist and the patient's required and patients that and the patient is required to take other particular pharmacotherapeutics, then the patient should not be offered a siligine, as it can cause ABP, arterial blood pressure, or arterial blood pressure or ABP like crises due to the pharmacotherapeutic interactions, and in context of how particular pharmacotherapeutics are metabolized by monoamine oxidase A. At the same time, C. Jefferson talks a little bit, or informs a little bit in around pharmacotherapeutic ropinerol, which is a dopamine agonist that binds to dopamine receptors in the central nervous system and has similar effect to dopamine. And when combined with levodopa in late stages of the condition, in late stages of in around Parkinson's, um, and in around the late stages of Parkinson's condition, and its progression, which can reduce symptoms of the sort of the on-off phenomena. The on-off phenomena is sort of described as phases of good control and phases of Parkinson's-like symptoms that occurs after several years of levodopa use. Pharmacotherapeutics that reduce the cholinergic effect are most commonly used in recipients suffering with tremors and don't have much effect on bradykinesia. So this would be unsuitable pharmacotherapeutic for the patient. In this case, that's C. Jefferson. In the case where C. Jefferson had had developed their writings around or works around. So most pharmacotherapeutics are used to treat Parkinson's can cause sort of other particular symptomologies as dopamine receptors in the chemoreceptor zone are triggered and causing emesis. So C. Jefferson then goes on to then informs that the best pharmacotherapeutic plan would be for the patient or the recipient to be offered the lowest effective dose of co-carbidopa, and if symptoms still persist, that this could be that co-carbidopa could be utilized prescribed in combination with siligine. The patient should also be offered additional aspects of care to improve aspects of coordination. C. Jefferson then informs on where in around 2023 there were 76 active trials for Parkinson's pharmacotherapeutics with just under 30% of them focused on relieving the sort of motor symptomologies. Researchers at one of the academic institutions in the United Kingdom had initiated a clinical trial to investigate how dopansonitril, an anti-inflammatory drug, slows the progression of Parkinson's, and the research informed that alpha-synuclein, a protein that when accumulated precludes normal function of dopaminergic neurons and activates NLRP3 inflammasome in immune cells, causing inflammation. Dopanucentril could preclude this cascade, preventing inflammation and slowing the progression of Parkinson's in recipients. In another academic institution, in some works that C. Jefferson had developed, had their writings in around. In another academic institution in 2023, there have been trialing of ambroxol, a pharmacotherapeutic normally used to treat respiratory conditions or illnesses due to its anti-inflammatory due to its its anti-inflammatory bases, and researchers formed and sort of claimed that ambroxol could increase the removal of alpha-synuclein. However, the trial is still, or had still been going on at the time when C. Jefferson was developing their writings, as participants, and at the same time as participants are required to take ambroxol for about 2 years, where the ability to slow the progression of Parkinson's is then determined. So that draws this audio podcast to a close. This audio podcast, as part of the Myelin episode, this audio podcast as part of the Screech and Hurdle, this audio podcast as part of the lab squad and Gorilla, and this audio podcast as part of a Storm Lobostics production.